Okay, it's good to see we've got a few people here today. Today we will be talking about alternative therapies and arthritis. And a lot of the questions I get come through are about, well, what is the difference between alternative therapies and complementary therapies? So I'll be unpacking that a little bit shortly. And just to let you know that next week, there will actually be another webinar that speaks specifically to complementary therapies. And today I'm going to be talking more to the, different treatment options that fall under that alternative therapy umbrella. So I just want to provide an acknowledgement of traditional owners. So in the spirit of reconciliation, Arthritis New South Wales acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. I do have a disclaimer to just share with everyone. So this presentation is just to provide you with general information and advice. Every effort we have made to ensure that the information presented today is accurate and reliable. The content of this presentation isn't to serve as, a substitute for the individual treatment advice of your doctor or health professional. So if you are seeking our alternative therapies for the purpose of managing your pain and your symptoms, I will encourage you to always speak with your primary healthcare provider before going down that path and seeking this, using this information to seek out that treatment. So I just want to confirm before we get into it that you can all hear me okay. Zoom is working okay for you all. So just let me know through the chat if you have any kind of issues, and maybe I can pause the presentation. We can seek them out a bit later. So today we're going to be talking about alternative therapies in terms of what they are, where do they fit in conventional medicine, and more specifically, we'll be speaking to massage therapy, acupuncture, dry needling, taping, low-level laser therapy, and thermotherapy, which you might all be familiar with. So thermotherapy is the use of hot and cold temperatures for managing symptoms. And we will be speaking about their efficacy, their safety, just give you guys some insight to some of the side effects that can occur, and just some of the things to be aware of if you go down this path and want to try any of these treatment options. Okay, so alternative therapies are also described as complementary therapies or holistic therapies, which basically all refer to non-conventional treatments that are used with or instead of our traditional kind of mainstream medical approaches. So these therapies include a wide range of practices such as acupuncture, massage, herbal remedies, dietary supplements, mind-body therapies. And so often alternative therapies are practical treatments that are applied to manage a condition, manage symptoms or pain. Complementary therapies refer more to that whole system of medicine, and they're more referring to those traditional medicine practices like Chinese medicine, Ayurveda. And so normally complementary therapies embody the whole process of going from clinical assessment to diagnosis, treatment, and monitoring. Alternative therapies are pretty much the practical treatment that's used for a few reasons. So usually people are seeking out these therapies for a few different reasons. First, many people who are living with arthritis are looking for different ways to manage their symptoms so they don't rely solely on medications. That's what we do encourage you guys to do here at Arthritis New South Wales, is to basically explore those non-pharmacological approaches. Or maybe it's the fact that you might have concerns about long-term use of anti-inflammatory drugs or biologics like disease-modifying anti-rheumatic drugs, and you want to avoid the potential side effects that can come later on. So I'm just going to admit a few more people into the room. Secondly, there are some people who might find alternative therapies that are better suited to their values, or they have stronger beliefs in holistic approaches to healthcare, where they're seeking out a practitioner who will look beyond just treating physical symptoms, and they do believe in addressing not just the physical symptoms, but the emotional, the energetic and spiritual aspects that are attributed to a condition. You also have the fact that some individuals don't find there's much effectiveness in the conventional treatments that they've been using for quite some time. And so some people might find that the medications or physical therapies that they've tried so far have not been effective in completely mitigating their pain or their symptoms. So they're looking to try new therapies. So I'm interested to hear about what interests you in alternative therapies and why you here today to kind of listen into this presentation. I'll give you guys a couple of minutes to provide your answers in the chat box. I'm getting a few questions come in about the low inflammation diet and collagen supplements. So next week, they'll be talking more to nutraceuticals, dietary supplements, and we do have some webinars coming up next month that are nutrition focused. So we'll be speaking to the anti-inflammatory diet, Mediterranean diet, Australian dietary guidelines, and nutrients that confer certain health benefits that can alleviate inflammation. Okay, so alternative therapies, first of all, they can be divided into two types. You have active therapies that refer to treatments that involve the patient's participation, whether it's physical activity or movement, exercise, yoga, tai chi. These are examples of active therapies. Passive therapies don't really involve much participation. They're more designed to induce relaxation, and they do encompass stress reducing practices. So they'll involve someone else administering the treatment, acupuncture, massage, aromatherapy. These are just some of the examples of passive therapies. And now it's important to note that while some alternative therapies might be effective for some people, not all alternative therapies are backed by the highest quality scientific evidence. That's just due to the limitations we have in research. And so it's always a good idea to consult with a healthcare professional before trying any of these alternative therapies for yourself. So what we'll do today is hopefully help you understand what they're about, and so you can explore these safely and appropriately. So alternative therapies have traditionally been separated from mainstream medicine and conventional treatments due to the lack of scientific evidence backing them up. So in more modern times, healthcare practitioners have started to embrace more holistic approaches to healthcare, and they've become more accepting of these alternative therapies. This is partially due to having more research that's available. It's also due to the fact that more and more people are starting to explore them. And so when we seek out alternative therapies, I do say they're not always backed by the highest quality evidence. Instead, they're backed by evidence-informed practice. And so what is the difference between these two? Evidence-informed practice involves considering the best available evidence in decision-making. So an evidence-informed practice takes into account clinical factors, treatment preferences, and the practitioner's clinical experience. So often the therapy that is administered is largely based on clinical judgment and expertise. So a lot of their decision making is based on what has worked in their time as a practitioner for clients with very similar presenting complaints that you'll be presenting with. So for example, if an acupuncturist has found a specific technique to work on a previous client with very similar presenting problems or a diagnosis, they might apply the same technique, or at least a very similar one, to see if it works. So it's very individualized. It's highly tailored to your specific needs. Evidence-based practice, on the other hand, it does rely heavily on the highest quality research and the best available evidence. So it's a lot of the clinical decision-making is based on what's available in the research and what is the best available research that's being done. So randomized controlled trials are usually used to guide decision making. They do factor in patient values, preferences, and it also factors in clinical expertise. So alternative therapies are often delivered by complementary medicine practitioners. Complementary medicine practitioners come under the primary care banner. That is, they may be one of the first, maybe one of the many practitioners that are seen as part of a first line or contact of care in the Australian healthcare system. So this list here shows you who is considered a complementary medicine practitioner or an alternative therapy practitioner. So we have naturopaths, homeopaths, nutritionists, massage therapists, chiropractors, osteopaths, and acupuncturists. You often don't need a referral to see these practitioners, but if you do seek them out yourself, just make sure that you do your research. You choose a practitioner who is licensed or certified by a recognized association, or they have a good reputation. And so ask a lot of questions in regards to the treatment that you are seeking out. So in the next couple of slides, we're going to hone in on the main alternative therapies that people use to manage their arthritis, and maybe you can use this information to canvas your questions if you go down this path and seek out these therapies. A lot of these therapies are attractive to people for so many reasons. Some people use this as the main source of healthcare. Other people use it as an adjunct to the main healthcare they receive. A few reasons being that some of these practitioners are very close to home. They are accessible. They're also affordable. Some people, it might be culturally acceptable and trusted by a large number of people. And so all these things make these therapies all the most attractive. And so there are many reasons why people seek these treatments out. So we'll jump in and talk about massage therapy. So massage therapy can be a beneficial alternative therapy for individuals who are living with osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and fibromyalgia. It usually involves the manipulation of tissues using pressure, tension, motion, or vibration, and it aims to target the soft tissues of the body, such as the muscles, tendons, and ligaments. And usually it's administered using hands, fingers, elbows, in some cases, mechanical aids. And so it does aim to alleviate pain, stiffness, and reduce muscle tension causing joint pain. Usually remedial or therapeutic massages aim to address injuries or chronic muscular pain that is caused by arthritis. In relaxation massages, they tend to focus more on using techniques that can help with stress release and reduce that general muscle tension that comes with a buildup of stress. So there is some evidence that massage can help improve joint flexibility, range of motion, reduce pain, and make it easier to perform daily activities. Many private health funds as well, they do provide rebates for remedial therapeutic massages. Just always make sure that you are covered. So contact your health fund and check with the therapist just to make sure you're eligible for that. Okay, so the different types of massage, we have deep tissue, myofascial release, trigger point, Swedish massage, and shiatsu. Deep tissue usually involves the use of slow, firm pressure to reach deeper layer muscles and connective tissue. It's usually designed to help release chronic tension, which is said to be helpful in relieving pain, stiffness in arthritis, and usually the masseuse will use their fingers, hands, forearms, elbows to apply the pressure in an affected area. This one can cause pain, and massages really shouldn't be painful. And you do need to use that as a sign because it can potentially aggravate an affected joint if it is too deep. So it's not always going to be advised for osteoarthritis. There needs to be a lot of communication between yourself and the therapist if you want to try this as a treatment. Myofascial release, on the other hand, involves applying a sustained pressure to the fascia, which is a connective tissue that surrounds and supports muscles. So this technique is actually designed to release restrictions and tension in the fascia, which can cause pain, stiffness, limited mobility. This one is more safe for rheumatoid arthritis and osteoarthritis. So like any alternative therapy, you do have to consult with the doctor and the therapist. The trigger point, it does involve the application of pressure. There's also the use of vibration into the myofascial trigger points. So trigger points are localized areas of tension that can actually cause a lot of pain and stiffness. So if it's done correctly, it can be okay for rheumatoid arthritis and osteoarthritis. Swedish massage, it often involves long flowing strokes, kneading, circular movements along affected muscles, tissues, and there's also the inclusion of techniques that can help relax the muscles and the surrounding tissues around affected joints. Usually that's a contributing factor to impaired mobility. So when those muscles are relaxed, the more movement you can get out of an affected area. And so this one here is most commonly used for osteoarthritis, while in RA, there's no such evidence to suggest it's helpful for affected joints. It's more helpful in the fact it can induce a stress release. And we'll talk about all those fun chemicals that get released under relaxed circumstances. The last massage is shiatsu, which is a Japanese technique that uses pressure and stretching techniques to balance the body's energy flow. So this type of massage is more traditional and in line with Chinese medicine theory. It's said to help mobilize the joints, improve movement, and relieve stiffness. So these treatments, they do target specific problem areas. They are more likely to be beneficial for temporary pain relief, temporary stiffness, and reduced mobility. Although there is some evidence that by continuously adhering to this therapy, it can improve long-term outcomes. So there are many myths in circulation and many untrue claims and anecdotal evidence that use almost like a hook, line, and sinker to allow you to believe that massage can do more than what it really can. And these are just some of the claims you might have heard about yourselves. And what I want to do is walk you through the truth. So the thing about massage, it's very effective for improving baseline anxiety and depression, which is very common when someone is diagnosed with a chronic pain condition. When someone receives a massage, it's very relaxing, and this can help with reducing the perception of pain. This also ties into with its neurophysiological modulation. So it has certain effects on the nervous system, which help you be able to regulate the perception of pain a little bit better. There's also mechanisms that address the mechanical aspects. And this is because when you massage a particular area, it might be able to improve blood flow, which when blood flow is improved and circulation is improved, it can induce healing properties. What I want to take you to is the evidence. So something I want to point out is that in 2018, the Royal Australian College of General Practitioners released a statement, and they made a claim that no recommendations can be made for complementary and alternative therapies and nutraceuticals for knee and hip osteoarthritis. Now, the evidence for the effectiveness of massage in managing arthritis is still relatively low, and this is due to a number of different factors that you should be aware of. A lot of this is to do with the complexity of the condition. Because arthritis can manifest in people differently and it can affect different joints in the body, it can make it really difficult to compare the results across studies. So a lot of the research you read will be inconclusive. The second reason being that it's very difficult to conduct high quality studies with massage. So most of the studies that have been done to date have been of a small cohort of a short duration, and they've lacked control groups or blinding, which ultimately affects the validity of results, making the research again very inconclusive. There's also due to a high variability in massage therapy techniques, with pressure levels and durations changing amongst different practitioners. So this can also affect the outcomes of the therapy. But what I want to say is, while the evidence is low quality and very limited, it doesn't necessarily mean that it's not appropriate or won't work. It's a matter of seeing someone, a practitioner, who will take into account your individual needs and tailor that therapy accordingly. Some people find it effective and some other people don't find it effective. Just some precautions, contraindications, side effects to be aware of. We have potential for bruising. If you're someone who bruises easily, this could potentially be a side effect you experience. Temporary pain, discomfort, or there could be an allergy to massage oils. In very rare cases, you have something called rhabdomyolysis, which is a breakdown of muscle tissue that releases a damaging protein into the blood. So it's a protein called myoglobin. If that is released into the blood and it gets to the kidneys, it can potentially cause damage, but this happens in very, very rare circumstances. Some other precautions: if you're taking blood thinners such as warfarin, if you have a history of DVTs, contagious diseases, fever, inflammation, or you've previously experienced rhabdomyolysis, always consult with your doctor or your primary healthcare provider before you go down this path and seek this type of therapy out. Most cases, it's relatively safe. The next therapy we'll look at is needling, and a very common question we get is, what is the difference between dry needling and acupuncture, and which one is going to be better for relieving arthritic pain? So while there are some similarities between the two therapies, they both use fine stainless steel needles, which are inserted superficially into the body. The difference is that dry needling is administered by physios and myotherapists. Acupuncture is administered by an acupuncturist. In acupuncture, needles are usually inserted into archy points that generally populate amongst the meridian lines or the energy pathways in the body. So they use channel theory, which is straight from the Chinese medicine philosophy, to guide their practice. And so the idea is that acupuncture works by unblocking stagnated, blocked channels of energy in the body. When those pathways are impaired in some way, it can cause disease and symptoms by disrupting that balance of yin and yang energy in the body. So basically aims to restore that general feeling of well-being, restore the flow of yin and yang in the body, which can restore qi. And qi is a Chinese word for life force, which basically means vitality. So when an acupuncturist administers this treatment, they do a constitutional assessment. They look at your medical history, your diagnosis. They do delve into some of the your childhood, adolescence, traumas. They look at your diet, your lifestyle. They apply a very holistic approach to understand where this, which energy pathway is blocked. Dry needling works a little bit differently. They intend to target trigger points and relieve tension in muscle fibers. The assessment is based largely on movement, where the restrictions are, where the stiffness is. They look at the severity of pain, and it aims to reduce tension by improving the blood flow in certain muscle fibers. So some claims for needling is that it increases blood circulation around the joint, it releases serotonin, it releases endogenous opioid release. However, there is no one mechanism that actually definitively explains the link between treatment and the pain relief that's experienced. Research suggests that it can help relieve pain, and there's a large body of evidence to support its use. However, according to the National Centre of Complementary and Integrative Health, there is limited evidence for its effectiveness in areas other than pain. So how acupuncture and dry needling work scientifically remain unclear. Some people claim that acupuncture works by balancing vital energy. Other people believe it's more of a neurological effect. So acupuncture and dry needling remains very controversial amongst Western medical doctors and scientists. And some of the most common claims made about acupuncture include all of these that we just went through. But if we go into the mechanisms and unpack it, acupuncture is believed to stimulate the release of endorphins, and endorphins are natural chemicals in the body that can actually modulate the pain signals that are experienced in the nervous system, and they communicate messages to the brain. So during times of relaxation, these endorphins are usually released, and that can help reduce that perception of pain. But endorphins aren't just released through needling. They can be released during any times of relaxation, exercise, eating certain foods, your favorite ones, even through laughing. Another potential mechanism is that it can elicit a local twitch response, which occurs when a needle is inserted into an acupoint, and it can cause the muscle fibers to contract briefly and lengthen, shorten tissue so it returns to its normal length and its normal tension, thereby potentially improving the mobility of an affected area. Although acupuncture is actually one of the most well-studied complementary therapies for musculoskeletal diseases, and it's widely used in treatment across many different fields in pain management, a lot of its efficacy is up to debate. The studies are becoming more robust over time, but the results that we can obtain show very mixed results. And there are a few reasons for this. You have trial bias, inconsistency regarding the clinical efficacy, and even the lack of well-designed human and animal double-blinded randomized controlled trials. You have small sample sizes. And when it comes to assessing how the meridian lines work, we don't actually have evidence that explains how they work in the body. So it is very elusive, but it doesn't hold up well under scientific scrutiny, and it's not a definitive recommendation for pain relief. But some people, again, will have very good experiences using this for pain relief. Other people might not exactly see it to be that effective for their particular condition. I saw someone in the chat box pop up a caution around dry needling, where it's caused pain. And so there's some of the side effects. You can get mild bleeding, bruising, very rare circumstances. You can have nausea, dizziness, fainting, or vomiting. A lot of the side effects here are related to the insertion of needles into the skin. If you are on medication or you have a medical history that concerns a bleeding disorder, this should definitely be raised with an acupuncturist or needle therapist, just to let them know that they should be aware of that. The next therapy we take a deep dive into is taping. So taping involves applying an elastic tape to the skin in specific patterns and tensions to support and improve the function of muscles, joints, and other soft tissues. Taping can be used to provide support or stabilization to the joints that are affected by arthritis. So this could be good for injury prevention. Taping can be used to support the knee joint in people with knee osteoarthritis, and it can even provide stability to the wrist or the hand in people who live with hand or wrist arthritis. There are different taping techniques that can be used depending on which joint is affected and also the severity of it. So it's really important to actually consult with a physiotherapist or a certified kinesiology taping practitioner to determine if it's an appropriate treatment option, but also to ensure you're receiving proper instructions on how to apply it safely and effectively. So some of the claims made about taping suggest it will support muscle and soft tissue, manage swelling, reduce the perception of pain. It might act as a feedback mechanism for neuromuscular retraining and help the brain might serve as a reminder to the brain in how the joint should actually move. And so the elasticity of the tape and its tension on the skin are aimed at helping really stabilize the joint and mobilize the skin, improve circulation, which can indirectly help the pain. So what is known about this technique is that it can help with reducing that malalignment just by restricting the joints that are affected and the movement and stabilize those. So a physiotherapist who is experiencing in assessing arthritis and taping techniques should really be the one showing you how to apply the tape as a precise placement that's needed for the maximum benefits. We take a look at the evidence. There is some evidence that suggests it can be a useful adjunct therapy for osteoarthritis and RA. There have been moderate benefits that have been observed from using certain taping techniques for different forms of arthritis. But for the same reasons as massage, acupuncture, a lot of the studies are of a lower quality and it still remains inconclusive. So that's what the levels of evidence indicate. A lot of the side effects and precautions are actually related to the application of the tape, and so skincare is really important here. And this is because some of the side effects that can be experienced are more to do with the irritation of the skin barrier. So it can include blistering, dryness, or irritation. Anyone who has a skin condition or sensitive skin should really apply it with caution, and it should be removed carefully. I've actually received a few inquiries around this form of therapy. Has anyone heard of low-level laser therapy? It's a relatively newer treatment. It might also be called thermal or cold laser treatment, or it's also referred to photobiomodulation. And so it has been around for over 40 years, and but it's more recently becoming more used in our mainstream medical centers. How it works is very elusive, but I'll do my best to give you a rundown on its mechanisms. So it is a form of phototherapy that uses a very low intensity laser or LED light to stimulate cellular function, to promote tissue healing and target the cells that cause inflammation. So it's said to more specifically affect the activity of the mitochondria, which is basically your powerhouse of all your cells in the muscles. And it stimulates the production of ATP, which is a molecule that provides energy to cells to promote the expression of biological factors with healing properties. And so it's said to reduce inflammation through that way. It's administered by trained laser technicians, trained physiotherapists, chiropractors, and some orthopedics surgeons are going down this path and trialing it in their practice. So just some of the claims made about LLT that you should be aware of. It suggests that it penetrates injured cells to promote healing, restoration, regeneration of damaged tissue and cartilage. It also alludes to the ability to reduce the formation of fibrous tissue, which is characterized by the excessive accumulation of synovial tissue, which can occur in osteoarthritis. There's not enough evidence that we have yet to actually suggest that it's effective in that way to alleviate inflammation and pain. It may have some effect on the expression of some genes that promote the production of healing factors and reduce inflammation. More of the research, the stronger research, points to the fact it might be able to produce endorphins, which again go back to interfering with that pain signaling. So while we have a huge amount of research that suggests it could be effective, a lot of it is very low quality. There's not a whole lot of evidence available to conclusively back it up. Some evidence suggests it could be a possible pain relieving strategy, but it's not currently recommended in any treatment guidelines yet. there are a lot of limitations around the research, and more specifically around the parameters that are required to achieve a therapeutic effect. So the parameters we're talking about include wavelength, irradiance, or power density, pulse structure, coherence, polarization, energy, irradiation time. And just to put it into perspective, the skin is the organ that is naturally most exposed to light. And so it's really important that when you're doing research, there's an optimal dose of light that is determined for a particular application of light treatment, which is very, very hard to do. So there's no reliable evidence to go back and say LLT will actually treat osteoarthritis effectively, because we don't actually have a universal treatment schedule or parameters that are determined effective at this point. So we need high quality randomized controlled trials to confirm its therapeutic benefits. So if this is something you are interested in looking into, definitely speak to the primary healthcare physician or your doctor for more information, because this treatment can be a little bit more expensive, and I'm sure there are other alternative options you can look at if that's going to be something that's not quite feasible. So LLT is deemed a safe, non-invasive therapy. There are no reported side effects with it. Anyone with light sensitivity, malignant lesions, carcinomas, history of skin cancers, pregnancy, there are recommendations around not treating directly on those areas, or there's advice to avoid it completely. The last one we talk about is thermotherapy, which can encompass cold or heat therapy. And these might be the methods that you turn to at the moment during a flare. These are one of the most common self-administered therapies that are used to treat rheumatoid arthritis, and they are backed by plenty of empirical evidence. Not the strongest form of evidence, but if we go back and have a look at its efficacy amongst people who use this during a flare, it's there are good effects from it. So thermotherapy involves the use of applying cold temperatures. It could be through an ice pack, frozen bag of veggies, cold towel, water to an affected joint to promote healing, reduce pain and inflammation. The same applies to heat treatment. So it's very easy, very cheap and quick to apply. And there are different times you may need to alternate the different methods. Normally, cold is actually used for injury and heat is said to be better for chronic pain. Both therapies are just as effective for osteoarthritis pain, but in rheumatoid arthritis, there needs to be caution around using cold therapy specifically if there's going to be, this is just due to compromised circulation or sensation, a medical history of Raynaud's, there's allergy, or any kind of history of frostbite. In terms of heat therapy, this is used to warm up and loosen stiff joints. So when heat is applied, it can induce something called vasodilation, which is when the blood vessels dilate, and that can increase blood flow to a certain area. When blood flow is increased, there's better circulation, increased delivery of nutrients, oxygen, and anti-inflammatory factors that can help the muscles and ligaments around the cartilage, which could help with stiffness and improve mobility. It's thought to reduce nerve sensitivity by actually altering the signaling activity of pain receptors in the nervous system. And so for some people, this is their preferred treatment option because of the comfort it can provide as well. There are some guiding principles of applying heat therapy, and that it should only be applied for periods at a time. So for minor stiffness or tension, Usually 15 to 20 minutes of heat therapy can be effective for the temporary pain relief. For moderate to severe bouts of pain, you might benefit from a longer sessions of heat therapy, like through a warm bath, a heat pack, or hot towel. And this could last from 30 minutes to about 2 hours. If the heat therapy session causes swelling, redness, or inflammation, you should avoid applying that. Cease it immediately until the symptoms subside, and maybe speak to your doctor. But also there should be a lot of caution around using this treatment, because it's not advised for people living with diabetes, dermatitis, vascular diseases, deep vein thrombosis, and multiple sclerosis. So just make sure you talk with a healthcare professional if you have any one of these diseases. The cold, on the other hand, is more for reducing acute pain and swelling. So how it works is that it reduces the temperature of the skin and the soft tissue, and it can induce something called vasoconstriction, which is actually the opposite of vasodilation. So it works to constrict the blood vessels and induce a local anesthetic effect, which will numb the inflamed area and block the nerve impulses to the joint. So if you're someone with nerve pain, this might be a better option. It is said to help lower the activity of enzymes that actually worsen the breakdown of tissue as well. So there are contradictions around the use of thermotherapy, cold thermotherapy, as well as precautions to be taken, and that's being: don't apply a frozen item directly to the skin. This can irritate the skin barrier. It shouldn't be used for more than 20 minutes at a time, and this is to prevent nerve or tissue damage. I don't know how that went there. And if you have any one of the following here, like Raynaud's disease, cryoglobulinemia, or you have systemic lupus or erythematosus, just use this with caution. It's really not advised for you to go down this path and use this type of treatment. Definitely speak to your doctor if this is something you do want to try. But there are strong recommendations around avoiding it. So there are a few ways you can actually apply cold therapy. You can use ice packs, ice baths, ice massage, vaporizing sprays as well. And just make sure that there's always a kind of protective layer over those ice packs if you choose to use them, and make sure you do it for several times a day for only 10 to 15 minutes. So side effects of thermotherapy can include changes in the blood pressure. So blood pressure can actually rise or drop, and that's due to the fact of those changes in blood vessels. You can experience cramping, irritation of the skin, more so with heat therapy, and burns. And so you don't want to use heat therapy for a prolonged amount of time. And you want to also make sure there's not direct exposure on the skin. Just make sure you're using precautions around open wounds, damaged skin, pre-existing skin conditions. And if you have any autoimmune diseases or blood disorders, always speak to your treating doctor. So although thermotherapy is one of the most common modalities used amongst people living with arthritis, the research that backs its efficacy, again, is very limited. It's of a lower quality, and the results have been very mixed. So if you are someone who responds well to this therapy, continue to use this type of therapy. If you don't, you might want to explore different options. In osteoarthritis, interventions using heat or cold therapy have been compared with standard treatments and placebo treatments. There have been positive results that have come about from that research and has shown to help with pain, swelling, and mobility in affected joints. In RA, interventions that have been using heat or cold therapy compared with a standard treatment or placebo, they've reported that they have enjoyed the therapy as opposed to experience any kind of mitigation in pain, and no changes have been observed in terms of disease activity. So this has been effective based on the fact that if people have enjoyed the therapy and preferred it to just not doing anything at all. And so if that's the case, you should definitely continue to, apply a preferred therapy. So that's just a kind of a demonstration of how challenging it can be to read some of the research that comes out about arthritis and pain management and our treatment options. And so if we're going to sum it up today, alternative therapies, they can be great for some individuals. They can be very cost-effective options to use instead of those conventional pain management therapies. They're great to explore as non-pharmacological approaches in pain management. There are some alternative therapies that will be covered by private health funds. So you always have to check with your organization and the package you're on to see if you're eligible to try this treatment. The evidence is very limited, but don't be afraid to try something new. It might be effective for you, or it might not. So as long as you're aware of the different research that's out there to support their use, and always make sure you're going back to your doctor or your main healthcare provider if you intend on going down this path and seeking out these different treatment options. There are a lot more that are available. And I did see some of the questions come through in the chat group about different supplements that are being trialed, what's going to be better. Next week, there is a deeper dive on those different complementary therapies, and more specifically on the different fish oil supplements, curcumin, collagen powders. That will continue on when we delve into the nutritional management of arthritis in June. So that brings us to the end of the presentation slides. I'm going to open the floor and ask you guys if you have any questions for me that I can help you out with.
Hello.
Hi.
Oh, it's Joyce here. I can't see where it says to put my hand up, so I'll just speak. I was wondering about, thank you for that presentation, it's interesting. Can you say anything about TENS and arthritis, transcutaneous electrical nerve stimulation? Mouthful.
Yeah, so we're talking about the electrical stimulation that acts directly on the nerves for pain relief. Is this something that you're looking into at the moment?
Oh, I'm interested in it. I have one of those machines that can do that. It's not made for that, but it can do that as well. And I thought if I tried it and it was effective, I could get a more dedicated instrument. But it's really for the back, I think. You know, I get stiffness in the back.
Yeah.
In the morning, so I'm just wondering whether it would help. There does seem to be a little evidence, but for it.
Yeah. So if anyone who hasn't heard of TENS machines before, it is transcutaneous electrical nerve stimulation, and they use electrode patches and apply them to an affected area, which sends an electric current through the nerves to interfere with the pain signals. So the idea is that if there's an interference in the pain signaling pathway, the brain can't pick up that pain, and therefore, it reduces that perception of pain that you are experiencing. There's some other evidence that suggests it can be used as natural kind of painkillers, again, by acting on the endorphins that can be produced when someone feels like they're using something that is working. So I always say never underestimate the placebo effect because it can be very powerful. And so in terms of the rigorous scientific methods we have to say that it definitely works, we don't have that just yet, but they're using it a lot more for chronic conditions with pain to help manage it a little better. And some people have really great experiences using it. Some other people feel like it just doesn't work. But yeah, again, it's acting on that nervous system pathway to actually interfere with that perception of pain. Does that kind of help you understand that a little bit better?
Yes, I was just wondering if anybody has had any experience of it.
Yeah, great. Why don't we ask everyone who's here? We have 29 people in the room. Has anyone used that a TENS machine for themselves? Someone's trying to send you a photo actually, but it's not allowing them to.
Can I say that I have a friend who had very good results from using the TENS machine for her pain, but that's my only experience of hearing and seeing the results.
I have had it used on me for, I've got arthritis in my feet. I didn't have a lot of success with that, but then when my physiotherapist used it on my knees, it was a lot better. So maybe he said because, you know, there's not a lot of muscle, there's tendons and ligaments, so maybe massage would be better for my feet. But for the knees, it was very good.
Okay, so that's interesting to hear that you found that it worked for one particular area and there is another option that's better for the other affected areas, because some people, they have osteoarthritis that affects them in one localized area. For some other people, it could be in a few different joints.
And the other complication, I suppose, is that there's TENS machines and TENS machines. So, you know, that's a variability that could give different results, obviously. I just quickly looked up Google and they mention a Cochrane report, which I haven't looked up yet, where 50% of people found that it had 50% less, 50% effect in lessening their pain. So it might be worth looking up.
That's incredible. And sometimes you guys are your best resources sometimes when you connect with one another in this community and you share your experiences trialing different approaches that might have worked for you. It can definitely be very insightful, and it can be very a very good lead for you to, you know, think about trying a different approach in your pain management. Of course, you do want to always consult with your doctor, but definitely connect with one another and maybe talk about the different approaches that you are trying at the moment and use them.
Yes. Actually, I haven't tried TENS because I find that using the trigger point with a pull noodle, and I only have to do it for 5 minutes, can relieve the stiffness in my lower back when I wake up. And it's good. It only takes 5 minutes to have an effect. And the trigger point is on my thigh somewhere. So it sort of goes around the corner to my back somehow or other. But the thing is, it works.
Excellent.
And I only have sort of mild symptoms at the moment. I'm just thinking further down the track, you know, may need something more. But thank you anyway.
No, thanks for sharing, Joy. I've had a question come in from someone who's asking about how you guys have found acupuncture. Has anyone used acupuncture before? No. Me personally,
I did
Yeah.
use acupuncture for a while.
Yep.
Before my knees got really bad, and it worked, but then I had to have my knees replaced.
how long were you using acupuncture for, Sandra?
Probably about 6 to 8 months.
And in that time, it helped you temporarily, like with your pain and your movement?
Yeah, it did for my knees. It did to a degree, but then my knees got really, really bad, so I ended up having them both replaced.
Yes, of course. Eventually get the surgery done. And how are they now?
Well, that was back in 2011.
Yep.
And they're going okay, but I feel that they're probably getting to the part of their end use date.
Yes, of course. Would you be considering trialing acupuncture again?
No, because I don't think it would really work to a degree, because I think when you've got metal in your body that it's aiming for, I don't think that the acupuncture would actually work properly.
Of course, yes. Well, thank you everyone for jumping in and participating and sharing your experiences. I've enjoyed working with you all today. Next week, on Tuesday, there will be a complimentary therapies webinar. I would encourage you guys to jump on and register for that. And I will be seeing you in a couple of weeks' time when we talk about nutrition. So thank you all for coming today. Have a great afternoon and a great week. See you next time.
Thank you so much. It was very informative.
Thank you.
Thank
Thank
you.